So speaking of the Wedge, tell us about the Wedge.
Yes. So the Wedge of Health Freedom, the website is jointhewedge.com. And you'll see on there when you get there that there's a part for patients and a part for doctors. So we're inviting doctors who are cash paying doctors, whether they are fee for service doctors, which means that there'll be a list of services and it says exactly what you have to pay for each service. So a fee for a service, right? That kind of a doctor, or a DPC, direct primary care doctor, where you pay a fee per month. And then you get access to all of the services that they list on their website, including often, email access, texting access, 24/7 access, that kind of thing. So we want all of the cash-based practices that we can find around the country on the Wedge so that people can find them. So what you're looking at here is the patient page within this free trade zone for healthcare, and patients can read this. Now, if you go to the facts page, the FAQ page, if you can go to that page, I can show just a few things to your viewers. So now click on the quick Wedge overview, and then I'm going to show diagrams and pictures. So this is a one-pager, two-sided one-pager, essentially, for people that can print it out and take a look at it. If you scroll up just a little, or down, I guess down, you'll see the Wedge principles, which shows you what our doctors, the doctors in the Wedge. So the doctors in the Wedge don't have to pay anything. And you as a patient don't have to pay anything. This is part of our nonprofit purpose. It's part of why we raise money from donors, is so that we can do this, make this available, because this is where we think healthcare needs to go. So you'll see 8 principles: transparent, affordable pricing, freedom to choose, true patient privacy, no government reporting, no outside interference, cash-based pricing, a protected patient-doctor relationship, and all patients are welcome, which means you can be Medicare, Medicaid, anything that you want to be, but you can come into the Wedge, find a doctor, and pay cash and get a real relationship. A lot of time spent with the doctor. These doctors spend time with you. They're like the old-fashioned doctors, right? So now if we go down just a little bit further here, because some people ask us, well, why did you call it the Wedge? And it actually comes from the fact that I told a group of doctors, so make sure you can see the 3 circles there. I told a group of doctors when I was giving a speech once that at the end of the day, we need a wedge in the healthcare system where all doctors and patients can escape when the government and the health plans say no. And so that's really how the Wedge began. And then this picture shows that today, doctors in the Wedge are often not known. A lot of patients don't know that they exist. So it's really kind of invisible. So that's the today. Tomorrow, we want to make it visible, and we want to grow that slice of the healthcare pie. And then in the future, we believe this is the way all of healthcare should run. We should not have health plans. We should not have HMOs. We should not have managed care. Those are the 3 terms for the very same thing. And prepaid healthcare is the other term for it. We should have real insurance with doctors and patients working together unencumbered, and the patients holding the dollars in their hands. So if you look at the second diagram there, it shows you what patients understand as well as anybody, and doctors do too, is that in that triangle, the payer is at the top. And the payer knows exactly what's going to happen. They have the dollar and the data, and they make the decisions. And the patient and the doctor are at the bottom, wondering and waiting to see what the payer is going to cover, how long it's going to take for the payer to cover what certain things are they going to say is experimental, or we don't believe it's necessary, all of that sort of thing. They have all this power. So we want to disassemble that triangle. And you may or may not be able to see this very well, but on the right bar, it says, so patient is on the top of each of those 3 bars, but at the right one, it has insurer at the bottom. So the insurer pays the patient, and then the patient pays the doctor and the hospital. And this is exactly what it was before. And what this will do is not only bring the prices down, because there won't be all these third parties demanding a piece of the dollar, every premium dollar and every healthcare dollar that you spend, in reporting, in monitoring, and analysis, and research, and everything else that they are going to do with your data to say whether or not you can have care. So there won't be all this interference. There will be price transparency because you'll hold the dollars in your hand and you'll say, what's that cost? And the doctor will have to tell you, and then you can negotiate a price. And then it'll be a real patient-doctor relationship. It won't have outsiders coming in to control the doctor, and it will be confidential. So there won't be all this sharing of information. And I know for almost certain that most of your listeners think of HIPAA as a privacy rule. But HIPAA is a permissive data sharing rule. That is how it's known officially in the industry and by the government. All of this sharing can happen with what the government listed one says, 2.2 million entities. 702,000 of people that you think should have your data, like the labs, the clinics, the hospitals, all of those sorts of folks, right? And then there's 1.5 million business associates. So we've got an entire page called the Patient Toolbox to help you in the exam room to protect your privacy from all these outsiders, as well as to protect your rights under coercion. So patienttoolbox.org. Patienttoolbox.org is the place that you can go and you can click on the boxes or the drawers in the patient toolbox. And we've got one on COVID, but we've got one in the hospital, one in the clinic, and one on when you're having a baby, because the hospitals are taking the blood out of the heel and sending it to the state. And a lot of states are keeping the DNA of the child without ever telling the parents. So we have these tools, and the Wedge is the place where you can go to find one of these doctors. And if you know a doctor that is doing cash today, just cash. We don't allow them to do government or insurance. It's got to be cash, check, or charge. If you know one of those doctors and they're not on the Wedge, invite them to the Wedge. Tell us, and we will invite them ourselves, because we want this resource for patients, and we want them to not only survive, but we want them to thrive, because this is where we want the whole thing to go. We're building a brand new framework for health freedom in America, which includes the Wedge as the place where you will find all of these entities. And we envision and are planning for, in our framework, cash-based hospitals, cash-based surgery centers. This is where it's got to go. We know doctors who already want to go there, and we're working at the legislative level and other levels to make sure there are no prohibitions on moving our framework forward.
Well, wow. That was a lot, Twila. And now I know why we connected on social media, because we think a lot alike. And in my book, Sickened, How the Government Ruined Healthcare and How to Fix It, there's a 6-step solution in chapter 6. And the first step solution is that patients need to take charge of their own health. And with that means financially too. Their dollars, they need to vote with their dollars. Somebody else should not be deciding where a patient's dollars go. Right. The patient needs to be in charge, like any other industry. The consumer needs to be paying the bill, and that will drive service, price, and quality. When a third party pays the bill, it doesn't work. You have escalating costs, and you have poor service and poor quality. And one of the steps too, just like you mentioned, doctors need to get out of the rat race. They need to get out of insurance. They need to be cash-based. They need to be paid directly by the patient. It makes it much simpler. It makes it much easier, much faster, much less expensive. And, you mentioned cash-based surgery centers. We know that that's not the future. That is here and now. They're popping up all over the place. Surgery Center of Oklahoma has been around for over 20 years. Right. And there's one coming in Moscow, Idaho next year. There's one that I know of in Wellbridge Surgical in Indiana. So that's not pie in the sky stuff. It's happening. And, I want to make sure that patients are educated and empowered to know about that so they can get the best service, the best care.
Yes. So the only reason the Surgery Center of Oklahoma is not on the Wedge is because they still use Medicare doctors. And Medicare, people will be surprised by this, but if you take care of one Medicare patient, Medicare claims a right to go into all of your patient's medical charts and have access to judge your quality as a doctor. And so we drew a really bright line to try to keep the government out of what we're doing.
Absolutely.